Santa Clarita's hometown station, AM 1220 KHTS. Here, James Brown. That means it's time for the Prima Pediatrics Healthcare Hour on AM 1220 KHTS. You can find more information, primapediatrics.net, or you can give them a call at 424-9000. Dr. Feldman joins us in studio. And, Doc, how you doing?
I'm doing great.
How was your 4th of July? We were going to do a show, but it was the 4th of July.
Yeah,
so
I
how was the 4th?
Yeah, 4th of July was very interesting. All my kids went to their in-laws, so it was just me and my husband, and it was lovely.
Oh, nice. Okay.
And 4th of July weekend, I did a 62-mile bike ride to Redondo Beach.
62 miles is a lot more than I would want to drive.
It's a metric century.
Yeah, that's insane. That's insane.
It was wonderful.
But you are doing that because you're training for your Bike-A-Thon happening
next week.
2 weeks. Yeah. Oh, well, next week, the 20th.
At this time next week, I will be up in San Francisco preparing to start the ride.
Okay. All right. Okay, so explain to people who haven't heard of this ride. What are you doing? What is it? And how long is it? Let people know how long it is, too.
Okay, we are riding from San Francisco to Los Angeles. At least my segment is.
Okay.
The whole ride actually started 3 weeks ago in Seattle. And
Wow.
that is 1,600 miles from Seattle to Los Angeles.
Good heavens.
I'm joining them for the last segment, the 4th segment, which is the San Francisco to Los Angeles portion. And that's 406 miles in 6 days, which means we will be bicycling 60 to 80 miles per day.
Whew. That's, but you're feeling good about it.
Yeah, I am feeling
Okay.
pretty good about it because, first of all, since I was last on the show, I did the qualifying ride. You know, in order for everybody to start the ride 3 weeks ago,
Okay.
or 2.5 weeks ago, everybody had to do a qualifying 60 miles. And I had a lot of trepidation about it because unlike the bulk of the cyclists, I have a hybrid. Everybody else is riding a road bike. And I was so concerned about it that about 3 weeks ago, I went and rented, for a lot of money, a road bike at Helen's Cyclery down in Santa Monica to see what the difference was.
Uh-huh.
I can tell you there were two main differences. Number one, half the power needed to get 3 times the speed on a road
Yowza.
bike.
Okay.
On the other hand, though, you're leaning forward, and in order to see the road, you have to keep your shoulders hunched and your head up. It killed me.
Gotcha.
I couldn't do it. I learned later that what they should have done is fitted me with a road bike with the higher handlebars, because I'm a shorty.
Yeah.
But, you know, what can you do? In the meantime, I realized that the cheapest road bicycle, and we're talking cheap, the least amount that will give you the advantage is $750.
Yeah.
I can't afford
Yeah,
it.
I believe it.
You know, and the average good road bicycle is running between $1,000 to $3,000.
I had a friend he was a big cyclist. He paid like $6,000 for his road bike.
Yep.
He got it like handmade in Italy. It only weighed like a half a pound or something crazy.
Well, yeah, those kind of bikes are real expensive. But
Yeah.
even the quotes reasonably priced ones, the ones that are good, really solid bikes that
Yeah.
you can really do, are like between $1,500 and $4,000. And the cheapest one that is even possibly worth your spending the money is $750.
Good grief.
I don't have that.
So you're sticking with what you got.
So I was a little freaked, but that Sunday I said, you know, I'm just going to see what I can do on my hybrid. And I rode from West LA to Malibu and back, which was 60 miles on
Nice.
the dot. And I had no issues.
Nice.
I was able to do it in 5.5 hours. And the qualifying ride, which was that one, was supposed to be you had to do 60 miles in under 7 hours.
Nice. Feeling
And
good.
I did it in 5.5 hours with 2 half-hour breaks for lunch. The best part of that ride, you're going to love this, and this is not for kids, but it is for grown-ups. On my way back, I stopped for lunch at this little bar on the beach kind of thing, and 2 guys tried to pick me up. I have to tell you, folks, I'm
Feeling good.
63 and very happily married. I have not had anybody try to pick me up in
right.
over 20 years.
Well, congratulations.
Thank you.
Yeah.
It really did my ego good.
So, okay, so you rode 60 miles. You start this thing next week, next Friday. You're going to be riding your bike. And for those who don't know, what is this ride for? What are you doing this ride
The
for?
important thing here, of course, is not just that I'm riding a bicycle.
Yeah, you're not just riding a bicycle, which is great. That is great.
It is great, and it's a great incentive for me to have gotten myself healthy, which is also very important. But the real incentive is this is called the Bike for Friendship, and you can go on bikeforfriendship.org. That's BIKE, the number 4, friendship.org. And what this is to raise funds for the Friendship Circle, which is an organization devoted to providing social and other supports to children and their parents who have special needs and disabilities. And the bulk of the program started with pairing up young adults, such as college age and late high schools, with disabled young folks, and basically as big brothers and big sisters. And they will go once a week and pick their friends up and these disabled young adults and teenagers and take them places and do things with them. And that provides two things. Number one, it provides a great social outlet and a way for these kids to have a friend that's closer in age to them. It's like a big brother, big sister program. And it also gives the parents 2 to 3 hours of respite.
Yeah.
But now, of course, it's really expanded, and now they provide all kinds of support to the parents, and they do activities now for these kids, and they provide equipment. So it's a big deal, and it started out as a little local organization, and it's now international.
Fantastic. So that's fun.
I am very
exciting.
pleased. It's right up my alley. It's right at my heart's desire because I would do almost anything for our kids with special needs. As everybody knows, that's the heart of my practice as well. That is my big cause in life. So to be able to go on a bike, get myself healthy, do the dream ride of my life, and do it all for such a great cause is just about the best I can think of.
Fantastic. And can people still donate to you?
Yes, you can.
How do people donate to your cause?
Bikeforfriendship.org, BIKE, the number 4, friendship.org. Go in there and choose Rochelle Feldman, and it'll tell you exactly how to donate and so forth. And here's the story, guys. I don't even care if you be $1 or $2. I mean, the more the merrier, of course.
Yeah.
But the truth is just by putting in just even a piddling amount of money, but giving, justice to the cause and cheering us on really is the important thing, to showing that you care about these kids and you care about this cause, because we all care very passionately. The cool thing about this ride, it's all women.
Yeah. Oh, that's even better.
Yeah. I mean, first of all, the difference between male and female bikers is often quite significant because men simply physically are more capable of going faster and longer because they have more twitch muscles, which are the fast-running muscles. But the other part of it is the solidarity amongst women to do this kind of thing, to raise this kind of money for these kids. We've got moms and grandmas and young girls who have siblings, and all of us are riding for our kids.
Awesome.
So this
All right.
is cool.
We're going to take a break. We'll talk more about this, and then you have some other stuff you want to talk about.
Oh, yes, indeed, I do.
And we'll talk about that more. This is the Prima Pediatrics Healthcare Hour. Dr. Feldman, primapediatrics.net for more information. We'll be back right after this. Santa Clarita's hometown station, AM 1220 KHTS. This is the Prima Pediatrics Healthcare Hour. primapediatrics.net for more information, or give them a call, 424-9000. And Dr. Feldman, she's getting ready for her massive bike ride that's happening next week. And you're excited. Did you threaten your family, or did you just tell them to be there?
A little of each.
Okay, good. As you should have.
I didn't have to threaten my grandkids because my granddaughter my 6-year-old granddaughter is so excited. She's already told me she's going to write a big sign that says, "Yay, Grandma!" and she's going to hold it up when I come in on the finish line in 2 weeks.
Good.
So that's my oldest granddaughter that lives in the States. I did have a very interesting conversation, however, with my oldest granddaughter, who is going to be 9 in December, and she lives in Israel in Tel Aviv. And we had a nice discussion last evening, and an interesting one. And I thought it's well worth bringing up here, because I was asking her, in light of all of the rocket attacks and so forth, I was saying to her, so how are things going this summer? She says, it's going really good, but, it's really annoying with all of these air raid sirens going off. And I said, I'm sure it is. I said, does it scare you? She says, of course it scares me. She says, I don't like the sirens because they interrupt what I'm doing. She says, and then you hear all the rockets exploding. She says, and it gets you kind of weirded out. She says, it's like having an earthquake every day, 2-3 times a day. She says, it's so annoying. And worse than that, she says, maybe at some point kids are going to be killed. In fact, she says, there are kids in East Jerusalem and in Gaza who are being killed because their stupid parents are sending rockets at each other. She says, why don't they just listen to us kids? I said, well, if they listen to you kids, what would you say? We tell them, cut this out. You grown-ups are being stupid. Stop sending rockets at each other. And I had nothing I could answer her with.
Yeah, what are you supposed to say to that?
I said, Nava, you're right. Nobody should start it, and nobody should follow it, and so forth. I said, but what do you do if somebody keeps sending rockets at you and you don't do anything? She said, you can't do that either. She says, but you can try to just kill off all the rockets that are coming at you so that it doesn't work. I said, well, you guys are doing that. She says, yeah. She says, but I just don't like the idea of anybody hurting anybody else. And I said, I don't either. And you know what? I would love it if the world would listen to you guys. She says, I'd go on TV with a kid from Palestine and they could both stand up and tell them to cut it out.
How old is this granddaughter?
9.
Wow.
She'll
That's
be 9.
Wise beyond her years.
Yes, she's very much like her mom, my oldest daughter, who was always 10 times more mature than anybody else. And she is the spitting image of her mom. And not only just in looks, but in mannerisms and in every which way. And I gather that my oldest daughter is very much the spitting image of me. We are lucky in our family we have, and I am the spitting image of my mother. We have one picture of the 4 of us together.
Oh, nice.
My mom, myself, my daughter, and my granddaughter all in one place. And it's like looking at one person 4 different ages.
That's fun.
It's very cool.
That's cool.
But I have to tell you, I'm listening to her telling me that. She says, and my brother, she says, now he's running around the house with sticks and pointing them and shooting at people. She says, that's just not nice. I said, that's right, it's not nice. She says, I don't like this. You've got to tell the grown-ups to cut it out. And I had to stop and think, and I'm thinking, she's so correct. Why can't people stop this? I don't care what ideas are in your mind. I don't care what's going on. Somebody's got to stop this. And I look at, and I'm thinking about the effects, so it led me, of course, to the internet and to my research, which I have huge files on, and the effects of war on children.
And yeah, that's what I was going to ask you. Obviously, there's going to be some psychological effects, I would think. That's an obvious thing.
There are.
And I assume that can
course.
lead to health risks, but what are some of the risks for kids
The
in
risks
war?
for kids, first of all, psychologically, of course, is that it will either lead them in and lead them into a cycle of violence just like their parents, because kids do imitate the adults.
Yeah.
It can also cause tremendous anxiety and fears so that they don't even want to go outside, which leads to its own set of health risks. And in addition, those are the main psychological things. And if they lose a parent or they lose a sibling, there's tremendous grieving going on and a sense of loss and a sense of disillusionment in the safety of the world so that they can't reestablish their own equilibrium. There's a lot of psychological effects on kids. Now, there's also, and I was thinking about not just in Israel and in Gaza, but then think about the whole situation right now with the immigrant children coming in unaccompanied after these harrowing trips from Central America and then being housed and warehoused in horrible conditions. I'm thinking, this is also the result of war. It doesn't have to be
It's not like you don't see it on rockets going across or anything, but
but it is a
certainly
result of a war. It may not be a nation against a nation.
Yeah.
But in Central America, it's the drug lords against
Yeah,
the
exactly.
common people. And it's still guns and terror. I was listening to a story about one 11-year-old boy who said that absolutely if he had it to do again, he would come again. And if they'd send him back, he'll try again to come back. Because if he goes back, his mother was killed by one of the drug lords. And he ran for his life. He says, and there's no way. He says, at least here, I'm not likely to be killed.
Good grief.
And that is, I'm thinking to myself, an 11-year-old kid worrying about being killed. And then I look back to my own family and recall the stories that my Aunt Shari and my Aunt Irene used to tell. They were Auschwitz survivors.
Oh, wow.
You know, and Shari was in Auschwitz at age 15, and Irene was, I think, 17. And how many generations have to go through all of this? When are we going to learn? This is just a terrible thing. Wars cause all kinds. It's not just the killing, which is bad enough, but look what's happened in Africa because of all the tribal wars. It causes lack of food, so children are starving and adults are. Lack of food. Disease, because it destroys the infrastructure, so you have no sewers and no electricity, and you have overwhelming disease and illness. Not only because you don't have the infrastructure with which to keep yourself safe from environmental hazards, but in addition, if you're continuously psychiatrically traumatized by bombing and shooting and all of that, it really affects your immune system, so that you can't fight off the disease as well. So we were talking about a true public health disaster when you're talking about war.
Do kids, I know obviously this is something that, military men and women deal with. Do kids deal with PTSD also, post-traumatic stress disorder?
Absolutely.
And are they worse off because they're so young, or would you say, what do you think?
It depends on the age and the degree of stress. If they've never known anything but, sometimes it can ruin their ability to feel empathy.
Okay.
So in other words, if they are exposed, if they are neglected, basically, and traumatized and beaten, basically, or shot at continuously from infancy onward, they may turn out to be hollow shells.
Yeah.
It will destroy the neural response that allows us to empathize, to feel sympathy from within.
So there's a physical thing that happens. It's not just a psychological thing. There's a physical thing that happens when children go through this, that they don't. Can you learn that again? Like, do you know what I mean?
It's a very good question. We don't know. Depends upon the age and the length of time that they've been exposed. Some kids can be retrieved and relearn. A lot of kids are irretrievable. And then it also depends on the degree of injury. For example, if a child is shot and they have to go through, for some kids it's horrible, and for some kids it's actually better. For example, there are some Palestinian children who are being cared for right now in Israeli hospitals who were injured
or
with the rocket attacks, because their parents picked them up and went to the top of the building, despite the phone calls, the warnings, and the pamphlets telling them to get the heck away, this is a target. They went to the top of the buildings and used their children as shields, which is the most horrifying thing I can possibly think of. And you take them from that environment and put them in an Israeli hospital, they actually might have done better, even though they have physical wounds.
Yeah.
Because they're cared for and loved and nurtured. It's very difficult to predict what any one given individual is going to do in the face of that. All we do know is that it is a terrible thing for children to be exposed to war of any kind in any place. The atrocities that happen in Africa, the kidnapping of the schoolgirls, it's just...
Yeah.
It boggles the mind. You don't want to think about these things most of the time because it's just too depressing. But if you ignore it, then you don't
it's going to keep happening.
Problem.
Yeah. And you're not going to fix it.
Yeah. So, the question is what do we do to fix this? And I don't have any really good answers.
Yeah.
But I do have one answer, and that is that we should value our children more than even ourselves or anything else. Children should be the most valued portion of every society because it is the children who are your future.
And it's funny, that's kind of been a theme, obviously not on this global, children in war scale that we're talking about now, but it's kind of been a theme the last couple times you've been on here is, parents, if you want your kids to be healthy, you need to be healthy too. It's not like you need to, it's a generational thing. It's not,
That's
and
right.
it's kind of along the same lines of stopping this because, you're just going to groom them the way the world is. You know what I mean? And
Exactly.
And if you don't want it to be like that, things need to change.
Things need to change. And people, and the question is how. And I think part of it is to have the bravery and the morality to say, we do not want to hurt people. And if they do get hurt inadvertently or because their parents put them in the way of harm, we will go and take care of them, and we will mourn with their parents their loss, and we will show that we are all human beings. To me, that is really the only way that this is actually going to come to a stop, is when everybody realizes that we are all human beings and we are all children of God, and that nobody is above anybody else, and that all human life is important. So, it's really a tough thing. I mean, this may not be medical in the sense of how to take care of it, but it is a public health issue.
Yeah.
And it's one that's very important. We don't pay as much attention to it here as we would if we were in the clips of it, but take a look at what's going on with the immigration issue here. I mean, if you believe that all these kids come over here because their parents want them to have a better life and that they just want to get them in illegally so that they can live like Americans and have car radios, you're really mistaken. The bulk of these kids came here and were sent by their parents through the harrowing trip that they go through where they can be abused and poorly cared for.
Yeah, it's not like it's a... I know some people that have gone through with the coyotes and stuff coming across the border and stuff, and it's not an easy thing to do.
It's not anything that I think anybody would actually choose to do unless they absolutely had no choice. Yeah. So don't think that these guys are here to steal their American dream. They're not. They're here to take care of themselves and to be safe.
And to be safe, yeah.
So, we've always had to balance the needs of humanitarian causes versus how much we can do and deprive our own people of stuff. But I think the balance has to be shifted towards that of helping people to take care of themselves. The whole issue, by the way, was brought up initially because, and it wasn't brought up because we wanted to deport these kids, it was brought up because these kids were being held in places by the immigration service that were horrible. They were being placed into these large caverns where the bathrooms, the eating, and the sleeping were all in the same place. There were like thousands of people in a very small area, and the conditions were disgusting.
Yeah. All right, let's take a break. We got to take a break. We're going to talk more about kids in war, and then we also have some other not as hard-hitting stuff, but we'll talk more. This is the Prima Pediatrics Healthcare Hour on AM 1220 KHTS. I feel good. Santa Clarita's hometown station, AM 1220 KHTS. This is the Prima Pediatrics Healthcare Hour on AM 1220 KHTS. We're also streaming live at hometownstation.com. Find out more information at Prima Pediatrics by going to primapediatrics.net, or you can give them a call, 424-9000. They're over there on Vía Princessa, right across from the Costco over there. Dr. Feldman joins us, and we were talking about the effects of war, because there's certainly things going on everywhere in the world right now with the kids coming from Central America, and you have the stuff going on in the Middle East.
And in Africa.
And then, of course, the stuff that's been going on in Africa for too long. But what are some of the things that we can do to I don't know, help the kids that have been through this trauma? What are some of the things that we can do?
Well, there are a number of things, believe it or not. And not everybody kind of feels helpless when they're presented with this, but there are a number of things. One of the things that we can do is nurture these kids, even though they're freaking out and some of them are like little shells. You can truly nurture them on a physical basis. You can feed them. You can take care of their wounds. You can cuddle them. You can smile at them, smiling, talking about fun things, good things, remembering that these are children who need to be children. You can play with them. You can be playful with them. All of these things, even if they don't seem to respond initially, these are things that make a huge difference for these kids. Treat their illnesses, treat their wounds, give them food, give them nourishment, both emotionally and physically. Those are the things you can do. And if you're here in the United States, you can help. You can actually physically, if you really want to, you can go to the immigrant shelters and help there. Take a day out of your life and go do something like that. You will find out that you will be more rewarded than you could possibly think of. It's worth it. Do that kind of stuff. And we're not even talking about just the immigrant kids that are coming here. We're also talking about kids who are living in war-torn areas in Los Angeles, like in the gang-related places, where they have to live, worrying about being shot every night. You can go there. You can bring flowers. You can come and hold the hands of their parents and show the parents kindness and the children at the same time. I was just telling you before, in East Jerusalem, the mother of the Palestinian boy who was kidnapped and killed, a delegation of Jewish moms, religious Jewish moms, came to pay a condolence call and to sit and hold her hands and tell them they were sorry for that everybody in Israel was sorry for that. And unlike her relatives who wanted to shoo them away, she said, no, I need them to comfort me. That's the thing. You need to go and hold people's hands. You got to get out of your little box. You got to get out of your little thing and your kids' games and this and who's insulting whom and all of that other stuff. And remember that humanity means that you are a human being and you reach out and touch others. That alone is going to make more of a difference to any war-torn child than anything else. Plus, make sure they're eating. These kids are undernourished because they can't get to these places. Like, for example, in Syria, there are so many refugees from that war, from that civil war, and these kids are starving to death. You got to feed them. We eat way too much here. Instead of putting it in our mouths, put it in their mouths. We don't need to be fed, and they need to be fed. Simple.
Yeah.
Just do one thing. If each person did one thing, you'd be amazed at the result.
Yeah.
So those are the things we can do. But most important, hug them, love them, touch them, bring them into you on a personal basis, a one-to-one basis. You'd be amazed at how much effect we can actually have.
Yeah.
So now we're going to go to summer.
Yeah, I think we should shift gears here a little bit. There's certainly different ways to help in all those. You can just Google it, and there'll be certainly thousands of
organizations involved. Whatever fits your bill. If you're religious, go with your church or synagogue or your mosque. If you're not religious, if you're secular, you can go with the human rights groups or whatever. Where there isn't a single political / religious / national / state, whatever organization that doesn't have a slot for you.
Doesn't help, yeah. Okay, so we're going to shift gears. We're going to take a break, and then we'll talk about some summer stuff. Summer stuff, kids, bites and rashes and all that stuff.
You got it.
We'll talk about that coming up next, AM 1220 KHTS.